If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
And hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. This is our 16th season. Now, as you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we're here to bring you timely health discussions. For those who are new to the show, there are two ways to get your questions in. First, you can call our live phone line at 718-499-6101. And second, you can email your questions to askthedoctor@netny.net, and we'll bring them into discussion. Now, for this episode, we have a great crew here. Wait till you see this. Now, Dr. Masha Bardash, she's a private practice psychologist. I think she specializes in adolescents and older kids. Dr. David Shifter, no stranger to the show, a cardiology attending at New York Methodist Hospital. And Dr. James Sconzo, making his third appearance, chief of dental and oral surgery and implantology at the New York Methodist Hospital. And welcome all of you. And I'm really excited about the show. We've got such varied topics: dentistry, internal medicine, cardiology, and psychology. We've gotten requests for psychology and dentistry, so you asked for it, you got it.
Thanks for having us.
We're going to get quickly to the news. We've got a lot of good things to show you here, but let's get to the news. A pill to fight prejudice. Be a good thing if we could do it, right? Cut down on some of the racism. They took people and they gave them propranolol, Inderol. It's a beta blocker. Many people take that when they get nervous and it helps them to speech. It also helps lower blood pressure and different, it's used by cardiologists. They found that it lessened the person's ability when you showed them pictures of different situations, whether you were black or white, that it changed the way they looked at it, the way they felt. It calmed them down a little bit and seemed that the calming effect helped to fight the prejudice impulses or the way it affected the body. Now, you still were prejudiced, but the body didn't get the same reactions. You didn't get a rise in blood pressure. You didn't get heart palpitations. So it's interesting. They're not saying put everybody on beta blockers who's prejudiced. It's an interesting thing, and maybe people can be conditioned by giving them relaxation exercise, and they'll think a little bit different. Yeah. Now, the second one, we heard about bad things about statins in the last couple of weeks. I'm going to ask Dr. Shifter maybe a little bit about diabetes and Alzheimer's. But this was interesting. Statins may cut Parkinson's risk. And they found that if you took statins, for people 60 and below, there was a 68% decrease in getting Parkinson's disease. The reason, they're not sure, but it panned out. And particularly for Lipitor, it seemed to work the best at that. So, again, not advocating that everybody go on statins because there are side effects, complications that you'd be afraid of. But it's a nice side effect if you can cut down on Parkinson's 68%. Remember, people 60 and under. Now, I'm rushing to get through this, so I want to get to our panel here. Too many Whoppers may be a problem. You've seen this ad, the stories about red meat and cancer. Red meat, having a red meat every day, whether processed or unprocessed, so it could be hot dogs or it could be, a hamburger that you put together, increases your risk of both heart disease by about 18% and cancer by about 21%. And you could cut back this risk just by substituting 1 or 2 days a week with chicken or fish instead of that. So don't overdo it. Again, in moderation is a good bet for everything. Now, along the same lines of meat, in case you're eating a supper, now what about pink slime? Right? People have heard about this pink slime they're eating. It seems that most hamburgers in grocery stores and up until last week in McDonald's had pink slime. And when they cut the food to send to the supermarket, little strips fall on the floor. They take this and they heat it up to get the fat out. And then they got this without fat, but they have a problem because the bacteria that cause the severe food poisoning are still there. So they take ammonium. You've smelled ammonia? It's terrible. And they put that over the pink slime, and now it's free of any bacteria. And what do they do with it? They stick it in the hamburgers to make it a little bit bigger, so you only have maybe 80% hamburger and 20% pink slime. Now, I thought it was pretty disgusting, and then I read now that the federal government has ordered, I think, 70 million pounds of this stuff to put in the kids' lunch at school because they don't feel that it's harmful. So I don't know about you, but my kids, I'm making peanut butter and jelly sandwiches for him, right? Pink slime, no. Okay, colon cancer does not have to be a killer. March is Colon Cancer Awareness Month. It's a good time to remember, you're 50 years old, get in and get the colonoscopy. These cancers take about 10 to 15 years to grow sometimes, so you really only need them every 10 years, unless your doctor feels you're at higher risk. You had somebody in your family who had it at an earlier age. But for most people, get it at 50, and then you won't have to get it till you're 60 for the most part. And you can save your life. Very easy way to save a life. So please do that. One of the few screening tests that has really shown significant results. Coke and Pepsi have something in common. You know that thing, the caramel the color that makes it look like Coke and Pepsi? Apparently it's a carcinogen. But there's a little debate about that. It was only shown in one study of mice that if you gave them like 1,000,000 tons of this, that they'll get cancer. So Coke and Pepsi probably could have won if they fought it. The opinion is that it's probably not proven enough to be a carcinogen, but they decided just to take it off the product. So it won't taste different. It may look a little different, but no more caramel coloring. Okay, I have to say hello to Monsignor Bennett, who hasn't missed a show yet. I didn't you saw Monsignor, he's out there. And I ran into Elsie Watson. She was walking down Marlborough Road, actually in Brooklyn, came over and said we're a big fan of the show, so we mentioned her. And Annie Jagborn on Cortellia Road. And I have to mention hardware stores. You want a great hardware store? This guy, Sam Levin, who I know is watching today, had some problem with the locksmith. He ran over, got it done. He's a great locksmith, great guy, so I want to say hi to Sam. Now our quiz. We have two quiz in honor of Easter. We have an Easter quiz and a non-Easter quiz. So the non-Easter quiz is, the first St. Patrick's Day parade took place in 1737. Can you name where it took place? So I don't know if the 1737 helps you, but where did it take place, the first St. Patrick's parade? And now for our Easter quiz. What is the most favorite foodstuff for kids on Easter according to a brand new study? These studies are coming out left and right. I don't wonder who sits down and does this, but the number to call is 718-499-6101. Tonight's topics are mental health, cardiology, dental and oral surgery. You can also email your questions to askthedoctor@netny.net. So what we're going to do is going to take a short break, and you're going to see a new and exciting thing, a new feature. You're going to see how some of the answers to medical quizzes by the listening audience, were answered as our roving reporter went out into the street. The first question was, name 3 signs of a stroke. Let's see what our viewers had to say.
You can't move some part of your body.
A headache,
Confusion.
a tingly sensation somewhere in your hands or feet. That's a guess. And blurry vision, that's also a guess.
Impaired vision, slurred speech, and being off balance. I don't know.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available, and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are mental health, cardiology, dental and oral surgery. Before we meet the doctors, let's see what you think are common signs of a stroke. And we just saw those common signs. I thought they were actually very, very smart answers. They talked about slurred speech. They talked about trouble walking. Talked about trouble seeing. Those are 3 good signs. Tingling sensations in the hands or any part of the body. And the biggest mistake you make is when you try and outsmart yourself and think it's something else. Or my elbow fell asleep or something like that. You start getting weakness, tingling, slurred speech. You get into the doctor right away, because the stroke can often be reversed and you have no problem. But if you wait more than a few hours, nothing can be done. So we hope you're going to do that. Now let's meet the doctors. We have a brand new face to the show, Dr. Masha, the last name? Bardesh. I had to make sure I pronounced that correctly. It could be dangerous. Yes, and you have adolescent psychology as a
adolescents and young adults.
And you also have a young adult at home.
No, I have a 6-year-old.
6-year-old,
Yes.
Yes, but he's mature, I thought, advanced.
He is mature.
Yes.
That is right.
So, and where do you live in Brooklyn?
Yes, I live in Brooklyn in Ships of Bay.
Oh, you like it out there?
I like it. I'm close to the ocean.
What do you think about the board? I don't know if you guys heard about the boardwalk, but they're putting plastic instead of wood.
Yes.
What do you think of that?
You know, it has its advantages. It's going to be sturdier
Yeah.
and smoother and maybe less splinters. but I think it will probably lose the authentic look.
It's
of
not the boardwalk
It's
anymore.
not
It's not traditional.
Yeah.
You- And you like to fall on it, you know, when you get, you know, you fall, and it happens. Like every kid goes through that.
That's right. It's a part of the
You
childhood
ever fall on
in
the
Brooklyn.
boardwalk? Yeah, so we're really looking forward, because I know this time of year people have mixed reactions to daylight savings time, to spring. Some are happy, some are sad. Holidays coming up, they're depressed. What, you know, you're going to give us some tips how to stay healthy and
Sure,
happy?
I'll try my best.
Very good. So it's great to have you here. Thanks
you,
a lot.
Dr. Diamond.
And you brought someone with you. You can give a shout out to her?
I
can't
have
even
a
remember.
support group waiting outside. It's my friend
Very
Michelle.
good. Michelle, welcome.
Yeah.
Dr. Schiff, I always love to have you on. Great
Thank
job.
you, Steve, and I appreciate you having me on again.
So, and what's going on in your family?
Oh, everybody's doing good. My daughter Sarah, she's up in Boston. She has a nice job there. She graduated from college last year and decided to stay in the area, get some experience. And my other daughter is on spring break, Margot. She's down in Atlanta at school there in Emory. And my other son, Alexander, he's a freshman at Tufts, and he's
wow.
Lexter. He runs for the track team there.
They're doing well.
They're doing very well, and I'd like to thank especially my wife for taking care of everything.
Yeah, she's the woman behind the man, as
Well,
they say.
can't do it without her.
No, it's great. So thanks a lot. We got a lot of. You're going to help us with internal medicine as well as cardiology.
I'll do my best, and the intro was very interesting, especially the pink slime and the Lipitor. We could ask a lot of questions on that if people want to.
Excellent, excellent. And what I want to do when I introduce the next guest, I just want to show you that we have versatile guests. Now this man, if you can zoom in, actually you may not want to zoom in with these legs, but if you zoom in here, this man goes swimming every day?
Once a month.
Once a month he's in the
least.
water. Whether it's winter, spring, summer, fall, you're out there.
Ocean.
I mean, and tell us about what were you doing in this
This
picture?
last February. We got our February jump in.
In February?
Yep.
Oh my.
Cold day, but
Amazing. I mean, what's
Get
the
out of the
furthest you
water.
ever swam?
5.5 miles.
How long
in
does
the
that
ocean.
take?
Just under 3 hours.
It's like going crosstown in Manhattan. Oh
Yeah,
my
right?
God, that's. But anyway, his office, I love that office where he worked, and I got Barbara, Allegra, Florence, and Trudy are the best 4 office staff people you
They're
can get.
fantastic.
Just fantastic. I love to go. And it was an interesting story. In today's, I think it was in the JAMA, women 40 and over are the worst. They have the most fear about going to the dentist, and many times 17% of them will not go to a dentist for any care.
It's kind of true. It's amazing. Well, not only women, but men too.
But this, for some reason, women, I agree that Marcia maybe can give us tips on how to overcome your phobias from going to the dentist.
Maybe give me tips on how to calm them down.
That's right. Calm them down.
Right.
Make your office hospitable.
There you
So
go.
now we have the line. I love the tie, by the way, New York City subway system.
Oh,
Which line
oh,
is
yeah.
that? The F I
It's
see running
Manhattan.
there?
B, D, F, Q.
Excellent, excellent. So what we're going to do is we're going to get to see who our first caller is. There's always kind of excitement, anticipation. Let's see who it could be. Could it be Grace, Maddie? I have to say, actually, Maddie's in the hospital. We'll show well, but let's see who this is. Hello?
Yes, it's me. It's
Grace,
You're
how-
right.
Grace, how do you do it?
Yeah, I'm very, very a little frightened. I went, about my thumb. Like
You
the
talk
doc-
up, Grace. I can't hear you. You have to speak a little louder.
Oh, I'm sorry. Remember I told you about my thumb that it's like a thumb, another nail growing over another nail.
Yeah.
My doctor thought it was a fungus about 8 weeks ago. I went to Kings County dermatology.
Okay, that was good.
And they're stupefied by it. They don't know what it is. It's not a fungus. And she called in 3 other doctors in the room, all women dermatologists, and they don't think it's a fungus either. So they took a little culture of it. They scraped a little culture, and they set me up for April 9th to go to
This is a
downstate.
saga of this thumb. We've been hearing about this thumb for 4 weeks now.
And I hate waiting. I'm nervous. And they want a biopsy, a doctor from downstate.
Okay, Grace, it's probably going to turn out to be something infectious. There's only one thumb, so we're not thinking of
Oh, but
anything
she
too.
she said we never know if it might be cancer, God forbid.
Well, you're getting it checked out, and you got it right away as soon as it did, so that's good. Do you have a quiz before I move on? Do you have an answer?
Repeat the quiz because my mind is on myself and I didn't concentrate.
Well, I'll let you call back if you come up with it, okay?
No. It was something. What was it about the St. Patrick's Day?
Where was the first St. Patrick's Day?
America.
America?
Great guess.
Is it in, well, Grace, I have to rule that out.
Well, wait a minute.
Not
I'll
America.
say-
It
I'll
was
say
America.
New York.
But we needed more specific information. But good guess, and feel better. Okay, Grace?
What was the second quiz? I didn't catch
No,
that.
you're going to watch. I'm going to give it now, and then you call back, because I want to let the others get through. Okay?
Okay.
So keep watching. Second quiz was the favorite food stuff of kids at Easter time, according to a new study. Okay, who's next with us? Patrick. Hello, Patrick.
Hey, Dr. Garner, how you doing?
How you doing, Patrick?
Dr. Garner, I'm getting so tired of not feeling well. I just maybe you can help me to I'm always feeling lightheaded. If I eat the wrong foods, I'm always having a problem with my stomach. The acids keep coming into my throat. I mean, maybe you can suggest something for me.
Yeah, I'm going to ask Dr. Schiff, and I'm going to ask Dr. Masha here, because he has panic attacks, or he has anxiety where he starts getting all fluttery feelings in his heart and tingling. Dr. Shifter, what do you think?
Patrick, this is what you're describing can be due to panic attacks, like Dr. Gardner. I believe you've spoken to him before.
Right.
But it can also be a sign of other cardiac disease. And the first thing to do is to rule out any other major medical problems before you say it's panic attacks. And you want to do a typical workup, take a good history and physical exam, do the appropriate blood testing, and any other cardiac tests if necessary. But if it is panic attacks, a lot of internists are comfortable treating panic attacks before sending to the specialist, the psychologist, or the psychotherapist, or even the psychiatrist for further medical therapy.
Thank you. And if it gets to that, Masha, what would you say? Can you have stuff for panic attacks?
Well, I would first say to, of course, get a medical clearance to make sure that you're addressing the correct problem. And those two things also can happen concurrently. So you can certainly check with either a psychiatrist who will help you out with the medications, or with a therapist or any kind of psychotherapy provider to help you out, to give you some techniques how to cope when they set on, and how to use relaxation strategies to make you feel better.
Patrick, why don't you call Dr. Masha after, and maybe she can work with you on this.
You know what, Dr. Garner? It's just the acid in my stomach. After I eat, I get very lightheaded.
Yeah.
And it's been happening too many years, Dr. Garner. I've gone through all tests and everything, and it's just, I'm really getting very upset.
It's frustrating. It's frustrating. You may have some reflux there, but I think you should give it a shot to work with you. I know you've worked with psychiatrists and psychologists, right?
Yes.
Why don't you give Dr. Masha a shot here?
I will definitely do that.
Okay.
I'll give her a call.
You have any answer to the quiz?
Well, I'm going to say New York on the first one.
Okay, let's do the first one. The first St. Patrick's Day took place in 17 and change. Where was it? Was it New York? Oh. I think Grace threw everybody off. What?
And we're going to work on the second one. We're going to go with eggs.
Is the favorite foodstuff of kids on Easter eggs? Oh, Patrick struck out, but you're pretty close. All right, have a good week.
You too, Dr. Leonard.
Thank you. We're going to take a break, but I got to look at one thing over here. Dr. Scanza, tell me what that thing is, the radar detector. Hold that up so the audience can see that.
This is a Velscope, and it helps to detect abnormal cell tissues in the mouth. Pre-cancer screening we use it for. We just got it at the hospital. We're trying it out. And when you shine it in the mouth, there's a little light here.
A little blue. Yeah.
And everything shows up green, and any abnormal cells show up black. So we can use this as we do our oral cancer screening. And I just want to remind everybody that April is actually Oral Cancer Awareness Month.
We have to rerun the show in April.
And it's painless, too, right?
What's that noise?
It's a fan that cools off the light in there.
That's a really cool thing.
So it shuts off right away. And it takes 1 minute just to look through the mouth.
And you'll pick up, if you look at 1,000 people, would you be expected to pick up 1 or 2 cancers?
If there's any there, it will pick it up, absolutely.
Beautiful. So let's take a short break, because we've got to set things up here, pay a few bills. Tonight's number is 718-499-6101, where our topics are mental health, cardiology, dental and oral surgery. And here's a repeat of the quiz for those who didn't get it at the beginning of the show. The first St. Patrick's Day parade took place in 1737. Where did it take place? Question number 2. What's the most favorite foodstuff for kids on Easter according to a new study? And our next medical quiz, a good one. Can you get appendicitis from swallowing a watermelon pit? Let's see what you guys had to think out there on the street.
Appendicitis from swallowing a watermelon pit?
False.
That sounds like one of those myths.
I'm pretty sure.
I'm gonna say false.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are mental health, cardiology, dental and oral surgery, where we have Dr. Masha Bardash, Dr. David Shifter, and Dr. James Sconzo. Now, during the break, we asked the question, can you get appendicitis from swallowing a watermelon pit? And some of the answers I thought were excellent. Well, actually, it was one answer. No, they said. So it was an excellent answer because that's the correct answer. You cannot. Many people used to think that it would get caught in a little pouch known as the appendix. It doesn't. It comes in and out. It does not cause appendicitis. So go ahead and swallow. But you will get a tree in your stomach, so you can watch that. Okay. So far, so good?
So far, so good.
Okay. Everybody good?
Excellent.
We have Dorothy waiting with us. Dorothy on line 3. Hi, Dorothy.
Yep.
Dorothy, what happened to your voice? What happened? Hello?
This is not Dorothy.
I know. I picked it up. Something gave.
Good.
So who is this?
This is Vinny.
Vinny, how are you doing? From 6th Avenue?
Avenue S.
Avenue S. How are you? Vinny, I got your TV on. Turn it off because we have a slight delay. He's on when you keep.
Oh, you got a delay?
Yeah, turn that off. You're getting confused.
All right. Well, I'm not positive, but I'm saying it's Avenue. It was in Boston, the first St. Patrick's Day.
Vinny, you got to turn off the TV. Turn the TV off, and then I'll take the answer. Okay, go and turn it off. Okay, we'll get Vinny to turn it off. Vinny's answer to the question was the first St. Patrick's Day ever took place in Boston. Is that true?
Was in Boston.
Vinny, there's pandemonium in the studio here, Vinny.
What?
That was quick.
Are you happy about it? You wiped out the question right off the bat, the third caller.
It was Boston?
Boston is correct.
That's it.
So, Vinny, well, let me ask you, you have never won before, have you?
Excuse me?
Have you ever won this contest before?
Nah, I won nothing.
Well, now you won. Now you're getting something very nice. Are you aware what it is?
No.
It's a beautiful plaque, handwritten in Japan. It's from Japan, and it says "Ask the Doctor" winner on it. And you can hang. You know where you're gonna hang it?
Where?
How about the living room?
Sounds good.
All right, Vinny. So you're gonna stay on. We'll take your name, phone number, and you're a winner.
Thank you.
Thanks a lot.
Right.
Okay, Vinny comes through in the clutch over there. Now, I don't know what happened to Dorothy, but let's see. He might have gotten rid of Dorothy for all we know. Okay. Kimberly, what's up?
Hello.
Hi, Kimberly. Where are you calling us from?
I'm calling from East New York.
Oh, very nice. We've spoken to you before or not yet?
I'm sorry?
Have you called before?
Never.
I know. I don't recognize your voice.
This is my very first time because your line is always busy.
I know. It's a tough show to get on. It's becoming very popular. But thanks. We're glad to help you. Is there any place yet in East New York to eat?
Olive Garden.
Oh, the Olive. Oh, along the Bell Parkway.
Yeah.
Have you guys eaten there?
Yeah.
Not that one,
No, not at that. What do you like to eat in there?
Spaghetti.
Nice. It's good. It's good for you. So, what can we do for you?
My question is for the dentist.
Sitting right here.
I was told by my dentist that I have periodontal disease. My question is, does it affect any other part or organs in the body?
That's a great question. They're finding that the bacteria that causes the periodontal disease actually can get in the bloodstream and can affect your heart, can affect multiple other organisms, especially women. Early childhood births are attributed to that. So yes, it can affect multiple other organs in the body. So we definitely should take care of that.
It's interesting. Dr. Schiff, have you been reading of the studies that Dr. Sconzo alluded to that plaque and bacteria cause a problem?
Right. I mean, besides having good oral hygiene, which is very important, especially if you like to eat, I think that there are people with rheumatic heart disease or acquired valvular heart disease will develop severe infections on the valve, and it can limit what they do and may even need surgery to replace the valve. So I agree.
Yep.
It's a significant problem.
Interesting. One other question to my, give a quick, if you had like a minute to tell somebody who's nervous to go to the dentist, and we're hearing all these benefits aside from just the clearing of periodontal disease, but heart disease and so on, what would you tell that person who doesn't want to go to the dentist because she's afraid to go?
Well, I think not just in case of the dentist, but whenever you're feeling nervous, but you have to go and do something either because of your health or for your family, the quickest thing probably is to take a few what we call diaphragmatic breaths. And those are not the breath when you breathe up, not when your chest rises. You just took a breath with your chest, but you need to breathe in with your stomach. So your stomach needs to go out and in, and that's your diaphragm becomes bigger, and it actually releases endorphins, which are good chemicals that make you feel a little bit happier. So on the count of 5, you inhale, you take a deep breath. Then on the count of 5, you hold it.
I'm doing it. I'm trying it. I'm trying. My stomach hurts, but it's good.
Yeah, you actually should put your hand on your stomach and feel it rise.
Try this at home. It's
and
nice.
Then hold it, counting to 5, and then exhale, counting to 5. And 5 actually of those, so there are 5s all around, will get you relaxed enough that you will see the advantages and the needs, and the anxiety will step away for a second or longer.
The audience now may be relaxed a little bit, right? This is good.
I sure
Don't
hope
turn
so.
off the show. You know, they fall asleep. That's the only problem. Okay, we're going to go to Tara. Hi, Tara.
Hi, I have a mental health question.
Oh, okay, we have
from Brooklyn, New York.
What's the question?
I have a problem with my mother. She's 66. We had the X-ray of the brain and blood work. She's like hallucinating. She also has sugar diabetes and hypertension, but she's always harassing the neighbor under her. She feels that the kids are coming through her door to her refrigerator. I am like, got her committed one time to Woodhall for a week, and she was going to Cumberland Hospital, and they had her on like a 1% medication, which was working. But she stopped the medication and everything when she found out that it's not mandatory that she goes.
How old is she?
She's 66.
And what's the question?
What is early signs of dementia? What other procedures can I do to see what's going on with her?
Okay, let's early signs of dementia.
Well, actually, Tara, what you just listed are the early signs of dementia, and I empathize with you. It's very difficult to see your loved one, your parent, act the way that is not typical to them, and this kind of paranoid thoughts and suspiciousness that someone is doing them harm or taking their things is very common during the dementia. Now, there are a few treatments that you could do for yourself. I would get some support and some education what dementia is. If your mom starts actually feeling a little bit aggressive, then there are some medications, low doses, that you could obtain from a psychiatrist who specializes maybe in geriatric psychiatry, because it's a little bit different, and they need to be familiar with other meds that your mom is on, and expect that this kind of paranoid thoughts and this thoughts that someone is out to harm her is not going to be responding to your logical convincing that this is not happening. In the scenarios when she's really feeling off, but you can't get her to the doctor, you can always call mobile crisis teams. There is one in Brookdale, and there are a couple of others. You can call 311, and those are the mental health professionals who come into your home, and usually for free, and they will help you out when they evaluate your mom at home.
Thanks, Dr. Masha. Appreciate that. Very nice answer. I got a shout out to Joe Stiles, the most loyal listener, great man. They're actually doing a movie They're doing a movie on his life. It's so amazing. And he's on boards of all the boards of major hospitals and religious organizations. So, Joe, it's great to have you watching the show. Thanks a lot. Now we're going to go to Josephine. Hi, Josephine.
Yes,
How are you tonight, Josephine?
I'm fine.
Where are you calling us from?
18th Street by Ocean Avenue.
Oh, I don't need the apartment number. I just was kidding. But 18th and Ocean. 18th
Yeah.
Avenue and Ocean?
No, between Albemarle and Beverly.
Oh, very good. Nice area.
Yes.
How are you doing tonight?
Okay.
What can we do for you?
I want to ask about a dental question.
Okay, go shoot.
I went to NYU School of Dentistry about 6 months ago to get new dentures, but they want to perform oral surgery in my gums, and I'm scared of that because they said my gums, it hurts me, so they want to cut it and do something, but I do not understand what they want to do. Do you think I should go to another dentist?
Well, you can go to another dentist to get another opinion. If you're nervous about it, we have Marsha that just told you about diaphragmatic breathing. But a lot of times if you need dentures, you may have excess bone up there and the denture can't get over that, that hump up there, so it needs to smooth it down or file it down. So sometimes you may need to have that, to have a comfortable fitting denture.
Yeah.
So that's good. So I hope you take that advice, and it's great to have you on the show. Thanks a lot.
Thank you.
Dr. Schiff, I wanted to ask you, I know we're going to be doing some public service work over the summer with you on showing people about echocardiograms and other things that could be done. Tell us a little bit about an echocardiogram, why you might order that, for what reason.
An echocardiogram is a wonderful test. It's a non-invasive test. It's not painful. There's no radiation involved. It's safe even for pregnant women. We do it on fetuses. And it could tell you a lot about the structure and the function of the heart and its valves. It's a very good tool sometimes. Now we even have handheld devices. We use it in the hospital to get information quickly. It's used in the emergency room in emergency situations where we can make life-threatening diseases, the diagnosis of the life-threatening disease very quickly and treat the disease rapidly. So it's a wonderful tool, but like any tool, you have to have it in the right hands.
Yeah, the operator. We're going to bring it maybe for next show. So if you want to see what that looks like, come to the Turner next week at 8 o'clock, and we're going to see how that works. Let's go to Anne Marie. Hi, Anne Marie.
Yes.
Where are you calling us from?
Yes, I'm calling from Canarsie.
Canarsie, great. We always lament that pier, Abbracciamento. I don't know if anybody remembers that. It was a restaurant on the pier. I don't think it was before your time, maybe. It was a very nice place. People used to go out there and sit in the restaurant at a great lounge. Remember it?
Yes, yes.
And it's dormant. Nothing's going on there.
Yes.
What can we do for you?
Yes, I would like to talk to the dentist.
Oh, he's very busy tonight, the dentist. He's right here.
Yes, how can I help you?
Yes, my question is, I have bad breath, and I would like to know how to get rid of it. And sometimes when I pull, I find some pieces of food from my throat, and I would like to know if there is a way to take them out, because I feel very embarrassed when I have to talk close to people,
So you have bad breath and you get food stuck between your teeth?
Yeah, no, not my teeth, my toe.
Her toes. Well, what do you want the dentist?
No.
Well, as far as
no,
the bad...
No, I said, how
it's the
can
tongue,
I get
it's the
rid
tongue.
of what
The
causes
throat, it's
bad
just the
breath?
throat.
My throat, my
The
throat,
throat.
my throat.
Okay.
Well, as far as the bad breath, you may have what's come up a couple of times tonight is periodontal disease. You may need to have your teeth cleaned real well to get the bacteria and the debris out from underneath the gums. As far as getting food stuck in your throat, you may just have to try to chew the food a little bit better and be careful when you're swallowing.
Interesting. Get caught in the throat. Dr. Shifter.
One question for her is, do you have problems swallowing any solid foods, or do you choke on liquids? Because sometimes it could be some sort of outpouch in the esophagus, and food could be getting stuck in there and causing the foul smell.
And certain medications, I don't remember offhand, can cause the breath to smell. That's. Are you taking any medications?
No, I'm not.
Okay. Right. Interesting. So we hope that helps you. And I know that.
But even you brush your teeth 3 times a day,
3 times,
so
you
you
can't
still
get that.
have the same bad breath.
It doesn't matter how many times you brush your teeth. If it's coming from your mouth, if it's coming from your teeth, you definitely need to see the dentist and have the teeth cleaned professionally, and that will help. You may have some severe periodontal disease. You may need to lose a couple of teeth. You know,
does that
definitely
stuff
see your
work?
dentist.
Remember parsley and stuff? I remember people were selling there was some product. You know, try some just as an old maid's type thing. You want to try the parsley, see what it won't hurt.
Or mint.
Okay, take care. I hope you feel better. Rosemary.
Oh, hello. How are you?
What do you think about this relaxation? I'm still trying to.
As a matter of
That's
fact,
why I'm relaxed.
you have a wonderful panel.
This is a great panel.
And the doctor, the mental health. First of all, Dr. Oz has this breathing on all the time. What's with you guys? You got to get with it. He knows how to do the breathing.
I know, and he's getting paid to breathe.
And that is wonderful. She's great. No, you know, she starts with, you know, right away, take the pill, take the pill. She teaches the breathing. Wonderful.
Excellent.
My question is for the dentist.
Wow, it's very busy.
I want to ask, my daughter is 25, and she went to the dentist, and they want to take her wisdom teeth out, or one out. I'm not sure which one. And she doesn't have any problem with it. Is it something that they do ahead of time before you get a problem?
You could ask multiple different oral surgeons, dentists. They're all going to give you opposite answers. Some people feel they should come out. Some people feel that if it's not causing any problems, it's okay to leave it.
Right.
There is one school of thought that before the roots actually form, it may be easy to take the tooth out before the roots develop fully.
Right. So
Rosemary.
Yes.
So I usually venture a guess at the quiz. What do you think?
Oh, I'm afraid to say it. If I win again, I'm going to say peeps.
Peeps?
You know
what are peeps?
They're those little like chicks, those little chicks, those little sugary chicks.
Oh, is it that little sugary
marshmallow?
Right, like chicks.
Like
and
marshmallow.
They make them in little rabbits and little chicks.
Is it these little rabbits and
Peeps.
chicks?
They're called peeps.
Peeps. They're called peeps.
Oh, I can't know.
The drum roll. Oh, Rosemary.
Well, I do have 4 already.
Yes, she's one of our. She's
multiple
Yeah,
winners.
so other people should get a chance to win that beautiful plaque.
No, but thanks for that.
Made
And you're
in
always in
Japan.
Rosemary's always in an up mood, and she makes us feel up.
Well, you're great. You're all wonderful. And I'm going to be practicing my breathing. Thank you so much.
Take care.
Okay, bye. Bye.
Very nice, very nice. Well, let's go to Shannon. Hi, Sharon.
Hi, doctor. How are you?
Talk up a little bit because we can't hear today.
Okay.
Beautiful.
Can you hear me now?
Beautiful, beautiful. Talk down a little bit.
Can you hear me now?
Yes, not as perfect. It's perfect.
Hi.
Where are you calling us from?
I'm calling from Crown Heights, Brooklyn.
Crown Heights. Still no restaurant in Crown Heights?
I'm sorry?
Any restaurants that pop up there in the last month or two? We never can find one there.
No, not really. Just a lot of kosher restaurants.
Do you ever eat there?
I've tried one or two. They have like a Chinese kosher down the block from me, and it wasn't too bad.
Very nice. What can we do for you?
I'm calling for the dentist because I have to have a...
I need to have a show the dentist here.
Ask the dentist.
Yeah, actually, I have to have a tooth extracted tomorrow, and I'm still in a lot of pain. But my concern is about the implant, and is there a time frame between getting the extraction and then getting the implant?
Well, depending on the
I can't
tooth,
get it right away.
Depending on the tooth and the situation, sometimes they can put the tooth in the same day they take. They could put the implant in the same day they take the tooth out. If they can't do that, you'll take the tooth out, and you usually have to wait about 4 or 6 months before you can place an implant in there.
Oh, okay. All righty. Well, that was my concern. I was just wondering if there was like a certain time period. I didn't really discuss that with them because I went in for the pain, and they can't save my tooth, so I was just concerned about that aesthetically because I think it's my first bicuspid, so it kind of shows a little bit.
All right. Yeah. It really depends on what the bone is and the situation that's there.
Okay.
But they may be able to place it the same day.
Okay, great. All right. Well, I guess I'll ask them. Okay. All right.
Thanks for the call.
Thank you so much.
Take care. I just got to ask Dr. Shifty sitting on. I want to talk about atrial fibrillation for a short time. If you could tell us, do you have to be on medication all the time for that? Is it harmful? Is it serious? Is something shortens your life? What is it?
Great question. And we see it's multiple ads now for different drugs on TV, pushing drug X or drug Y to prevent the main complication of atrial fibrillation. Atrial fibrillation is when the normal mechanism of the heartbeat, the electrical activity, goes awry. and it becomes very chaotic. And what happens is that you could develop small little clots in the upper chambers of the heart, which could shower through the system, and if it goes to the brain, you could get a stroke. It may go to other organs, but particularly we worry about stroke. Also could have problems with how fast the heart goes, but most of the people are worried about stroke. So depending on who you treat, it depends on what other risk factors you have. Do they have problems with congestive heart failure, where the heart is not pumping effectively? Do they have long-standing hypertension? Do they have diabetes? Have they had other strokes in the past? Are they elderly? Usually elderly have more risk of stroke. So these are the type of things that we look for that will help us determine whether the patient should go on a full blood thinner, such as a warfarin, which is Coumadin, or something like one of the newer agents like Pradaxa, which is becoming more and more seen, and on the TV especially, because you don't have to monitor blood levels once a week, once a month, or whatever your doctor thinks is necessary. But it's something that it has to be followed by a professional, and you have to be followed up. There are newer treatments to actually get rid of atrial fibrillation, and these are done by a special cardiologist who deals with electrical arrhythmias. Sometimes they could actually shock the heart back to normal, or shock the heart and put you on medication to keep you normal, or even use a catheter to try to zap the arrhythmia and to get rid of it. In the past, when people went for heart surgery, open heart surgery, sometimes the surgeons would actually make some incisions in the upper chamber to get rid of the arrhythmia when the heart is open, which is very fortunate because you're in there for another reason anyway. So there's a lot of different modalities to treat. It's a very common disorder, and it's prevalent, and it's something that we really need to get better treatment for, but I think we're making progress.
If I go to see Dr. Sconzo and I have atrial fibrillation, do I have to take any antibiotics before?
Atrial fibrillation, no, but you may have other conditions. It used to be that we used to treat a lot more people with what we call prophylactic antibiotics for dental work, for other types of procedures. But I believe the American Dental Association and the American College of Cardiology, the AMA, have come up with a consensus that only the most severe patients, patients who've had prosthetic valves, patients who've had prior infections in the heart, or people who have unresolved congenital heart disease, these are the ones that are at the highest risk. Those are the ones that we recommend to treat. Some people have been treated for many years and they're comfortable taking the medication. I kind of tell them the information. I say, you really don't need to take it anymore, but if you feel comfortable taking it, it's not harmful for you, it's not going to hurt like your kidneys or your liver, they feel more comfortable, we'll give it to them anyway.
Thank you. Thanks a lot. We're going to go to Esther, and then we're going to take a short break. So let's go to Esther and see what she's got to say. Hi, Esther.
Hi.
Hi, where are you calling us from?
Queens, New York.
Queens, which part?
Richmond Hill.
Richmond Hill. Where do you like to eat in Richmond Hill?
Pardon me?
Where do you like to go when you go out to eat in Richmond Hill?
Where do I like to go?
Yeah, like what's a recommendation for a restaurant out there?
Quality restaurants, Royal Indian Palace.
Royal Indian Palace and Quality. Very nice. Is that Quality is also Indian food?
Yes, it's all Indian food.
Very nice. Okay, we're out there. We try it. What do you got? What's your question?
My question is, I went to my dentist and he told me I had to get a root canal, but he couldn't find the root, so he just could find one root, and he sent me to the surgeon, and the surgeon could only find 2 roots. They couldn't find the third. So she did she did the root canal and did some filling or something. And she said, go back to the dentist. I came back that evening, and the next morning when I was eating breakfast, the little piece of tooth that was there to do like a cap broke. So I'm like confused. What should I do? And I'm still getting pain on this tooth that I just got filled. I have headaches and like my ears, everything is hurting me. So I want to know if I have to extract this teeth, because it's not 3 of the root they find, it's 2, and she did the filling. So I don't know how you can advise me.
What Dr. Sconzo has to say about this.
First of all, I would definitely see an endodontist, the root canal specialist, to double check that. And worst case scenario, you may end up losing the tooth if they can't clear up that infection. But I would probably see an endodontist. That's
We
somebody
actually-
that just does root
We
canals.
have Dr.
and-
Goldberger here next week, so
There you go.
we want to
Can
talk
call
to.
up next week and speak to.
We have an endodontist coming
Goldberger.
in. Okay, so call us back next week.
Okay, thank you very much.
Take care. What we're going to do is we're going to take a short break, and we're going to hear a $1,000 question about how do you, with adolescent is acting up, how do you deal with that? You know, what do you do? And when we come back, we'll be also discussing again mental health, cardiology, dental and oral surgery, and our next medical quiz for those waiting with bated breath. Most salt consumed during the day comes from pouring the white stuff on the food. So the most salt you get in your diet comes from pouring the white stuff all over the food. Let's see what you guys had to say. We'll be right back.
Do you mean like most sodium is from salt on food? That kind of, is that the question?
No, false.
Studies have shown that you get more salt, a typical American, I believe, gets more salt in their processed food than they do just putting it on their own food from a salt shaker.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and will even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Dentist. Ask the Doctor. Ask the Doctor, where our topics are mental health, cardiology, and dental and oral surgery. During the break, we asked you, most salt consumed comes from pouring out the white stuff on the food. Is this true or false? And we heard, I think that gentleman, I don't have his name there, but he did a very good answer. He said, most salt comes from processed foods, which is absolutely correct. Which then brings up a point. You go into a restaurant and you pour salt. That's not the majority of the salt. It's the food, and you don't see how much salt you're eating. You may not even taste it. So eating a lot of processed food is not good for you. I don't know. What do you think about salt and hypertension, Dr. Shifter?
Well, it's definitely shown to be casual. You know, people who actually eat processed foods, they go out and have their French fries. It's very salty, processed meats. And we see it in the office all the time. Yeah, we ask, you know, what did you do differently? Did you take your medication? Oh, I went to a party last night and I ate out, or I went to a friend's house and it was salty food, and we see that in changing the blood pressure. Also for other cardiac conditions like heart failure, they tend to put on weight. They gain weight, and that's one of the clinical signs.
So let's go to Masha. I wanted answered in 1.5 minutes, 2 questions. What do I do about my 2-year-old that has temper tantrums? What do I do about my 16-year-old that has temper tantrums?
Well, you know, it's funny, Dr. Garner, that's the question, because you pretty much will be doing exactly the same thing. About the 2-year-old, usually the temper tantrums will be reduced and decrease, and they will grow into a wonderful, loving 3- and 4-year-olds. And you just need to be very consistent in your parenting. And when there is more than one adult who is involved in parenting, all of them should be on the same page and should enforce consistent discipline. And when I say discipline, just the consequences for the kids' actions, and everyone should be on the same page. So that was the 2-year-old.
Yeah.
And with an adolescent, pretty much the same. Take a deep breath and relax, because it's also quite normative for them to act out, to rebel against you, right? We all know that. The thrill-seeking, a lot of times, urge outweighs the consequences that are known to them of danger or of being scared of a parent. But I think that one of the things a parent should do is to really talk to their kids, and I can't emphasize that enough, to know their world, to know their friends, to know whom are they on Facebook with, and to know their music, to be a part of that. And a lot of times, if you actually do listen, adolescents will share, and then as an adult you can give them a point of view that is a bit different from theirs, which is quite a lot of times maximalistic.
Perfect. 1.5 minutes. Did
oh
exactly
yeah,
what you asked
well, good.
Okay, let's get to questions. We have Teresa waiting patiently. Hi, Teresa.
It's Grace.
Grace,
Tell me to call back.
she calls
I
under
think,
Teresa and got
the
through. We wouldn't recognize her voice. Grace.
You think? I think the answer to the quiz.
Okay, let me repeat the quiz, Grace. What is
Yeah.
the #1 food stuff that children like at Easter time, according to a recent study? What do you say, Grace?
Jelly beans.
Is it jelly beans? Grace got jelly beans. I was looking for red jelly beans, but
Yes, I got it.
how'd you get it, Grace?
Yeah, well, I thought about it, and my husband says he thought it was that too.
Excellent, Grace.
That'll
Excellent.
be my third plaque, because the other two are beautiful.
You don't have as Rosemary's got 4, but you're catching up.
Yeah.
Very nice. Where is this one going?
In my living room, on the other wall, so it's balanced.
It's a crowd pleaser. It's a crowd pleaser. So we're going to work on for next week, Grace. Great. I'm glad you got back in, okay?
I'll stay on the line.
Take care. Stay on the line.
Thank you.
Okay, bye. Let's go to Karen now. Hi, Karen.
Hi.
Where are you calling us from?
Oh, I'm calling you from Brooklyn, the Ocean Parkway vicinity.
Oh, not far. It's all the way down, near the water or near the park?
Between Avenue O's and P.
Oh, okay. Nice area. I like that. You know?
Thank you.
What can we do for you?
I was recently diagnosed with TMJ, and the ENT suggested that I get fitted with a bite guard at any pharmacy and take over-the-counter leave 2 pills twice per day for 5 days. Do you recommend that?
Dr. Sconzo?
The TMJ are your joints. TMJ, there are a lot of different problems with the TMJ. So depending on what the problem is, a night guard or an occlusal guard may be the correct thing. But you really need to find out exactly what the problem is to see if that's going to help you or not. As far as the Advil, that helps anti-inflammatory. There's no problem taking that.
And doctor, can I get the bite guard at the pharmacy as the ENT suggested?
No, you need to see a dentist because it really needs to be fitted correctly and it needs to be adjusted very correctly.
Oh, do you have a dentist in your hospital that I could use?
Yes, at Methodist Hospital, you can have one made there.
Oh.
For sure.
So go and see. You might even get to see Dr. Sconzo walking around, okay?
Oh, what's his number, please?
Well, we're going to flash it on the screen, okay? You got the TV on?
Yes.
Go to the screen and you're going to see it, all right? We're going to move
Thank you,
on.
doctor.
Thanks a lot. Good to talk to you.
Same here. Bye.
You brought something. Let's show. I hate you to carry it in and not even show. Not that it's that heavy, but
yeah, this is Invisalign. It's the clear braces. Most people have heard of it at this point, but it's just a very thin shell that goes over your teeth.
Wow.
It's computer designed, and you wear this for about 2 weeks. Then after 2 weeks, you take another one, and it incrementally moves the teeth.
Amazing.
Just the right amount. You could be sitting next to somebody, you have no idea it's even on their teeth. So
How
a
does
lot
this
of times you
compare
can avoid the braces.
You can avoid the price of the braces?
It's probably just as expensive as the braces
okay.
are. So
All right,
not the
big-
price, but the look.
This is
And
great.
it's for a lot of cases, not all cases. You still may need to have braces for certain situations.
Does
But
every dentist do that, or you have to go to a special dentist?
no, more and more general dentists are doing it, but orthodontists do it. General dentists are doing it if they're certified, if they take the classes.
Invisalign. Think
Invisalign.
about that. Interesting. Go to Juanita now on line 3. Hi, Juanita.
Yes.
How are you?
Hello?
Hi, Juanita.
Hello?
Hi, you don't sound too happy tonight. What's going on?
Oh.
You want to turn off the TV?
Turn it off?
Turn it off because I can hear it. It's a delay. Yeah, it's distracting. Remember Juanita? And what show was Juanita the girlfriend of Bonnie Fife? Remember that?
Oh, yes.
His girlfriend. Mayberry RFD was Bonnie Fife's girlfriend. Juanita. What can we do for you?
Okay, I'm 55, and it's a dental question. My teeth has been falling. I'm now diagnosed with diabetes and high blood pressure and all that stuff. But my teeth is coming out very rapidly, and I have like partials on upper and the bottom. And I just look like a skeleton if you took them off, and it's very loose. One of the parts is very loose at the top, so it's always coming off. I got like maybe 12 teeth left in my mouth, and my dental plan is up this year. So I'm trying to see what is the best route to go because
Okay, I'm going to stop you here because we have so little time. I want to get the answer.
Yeah, get to your dentist, see what teeth can be saved, and if they need to come out, get them out and have either a new partial or a denture made.
It's tough. Is it related to diabetes?
That has a big effect on it.
Too bad. Juanita, I'm going to have to move on because we're in the rapid fire segment. Call back next week. Hi, Barbara.
Yes.
How are you, Barbara?
Doing great, thank
Great.
you.
You got in just in time. What's the question?
Well, I was wondering if when you have pain in your mouth,
Yes?
is it better to gargle with salt water or peroxide?
Pain in the mouth.
Yeah.
Warm salt water is the best remedy.
You like that? Warm salt water.
Okay.
Okay, let's take. We're going to go right to the next person, who is Cosmo. Hi, Cosmo.
Yes.
How are you?
Yes, hi, how are you?
Good, Cosmo. Talk up because we have only a few seconds left, and I want to get your question. And what's the question?
The question is if it's overdose of the Tylenol or Tylenol number 3, is that person used over 3 months every day?
Dr. Shifter can use Tylenol 3 every day for 3 months.
It's not supposed to get in the diabetic.
You can use it every day. Depends, but if you're just covering up a symptom for something else, maybe you need to get a second opinion. You can use it. You need to, if you're using it for that long, you can have addiction to the codeine. You could also have problems with the liver if you're taking a high dose of Tylenol.
He's diabetic, he says, so I don't know if that's
He needs to follow up.
You need to follow up, Cosmo. Thanks a lot for the call. Let's move on quickly to Dawn. Hi, Dawn.
Dawn, yes.
Dawn, how are you?
How are you?
Good. What's the question? I want to get it in before we close.
Okay, this question for the dentist.
Sure, what's up?
Okay, I recently went to my periodontist, and I had my teeth looked at. One tooth in particular, which 3 months ago he probed and said it was around a 6, but he probed it now, and he said it's a 9 on both sides. Also, this particular tooth had root canal a year ago, and about 2 years ago I had surgery on that tooth. Now the perio said the tooth should be pulled because the bone, I'm losing bone. I'm trying to save all my teeth. Is there any way that this tooth can be saved, or should it be extracted, or should I get another opinion?
I would get a second opinion, even get a third opinion. It's always one of the best things to do, but it sounds like it's getting to the point where it may not be salvageable.
Still, give us sounds like you get a second opinion maybe? You want to
Absolutely.
save it? Very good. I can't believe it. I don't know where the time went, but I'd like to get one last word of wisdom from each of you for the audience out there. One way that they're going to stay happy and healthy in this coming year, what should they do?
Spring is coming. Go outside, breathe air, and do social stuff. Be with your friends, be with your family, and enjoy life.
Thanks, Dr. Masha. Dr. Shifter.
Exercise, exercise, exercise.
Exercise is important, exercise. And Dr. Scanzo.
Make sure you brush your teeth.
This is I love this episode. Had to be one of my favorite all-time episodes. I hope you guys liked it at home. And I want to thank Dr. Masha Bardash, Dr. David Shifter, and Dr. James Scanzo for coming in. We hope we were able to help you. It is good to remember you should be proactive about your own health. Speak to your doctors about your concerns. Just as we were just talking about, go for second or third opinions. And visit our website at netny.net/askthedoctor. Or you can read here the weekly tablet column. You can watch past episodes. I want to thank Dr. Linda Lapatosa, our quizmaster. And I want to thank you all for your questions. Now remember, you tune in tonight at 10 o'clock. Very important for an encore presentation of last week's show. You'll learn a lot from that. It was a great show. Next week, we'll have a discussion on internal medicine, rheumatology, and yes, more dentistry next week. We have Dr. Goldberger with us. Goodbye, stay healthy, and I'll see you in the tablet.